Hello, this is Dr. Mark Baxter of Baxter Health Center in Las Vegas, Nevada, where I've practiced natural integrative health care for the last 30 years. When I first began chiropractic practice over 30 years ago, I did the typical types of treatments that most chiropractors do. I adjusted misalignments in the spine to help patients with headaches and neck pain and back pain and sciatica. I prescribed exercises to help tone up the muscles that keep the bones in place so they wouldn't have to keep coming back to me over and over and over again. And always having had an interest in nutrition, I paid a fair amount of attention, basic nutritional supplementation, a good multiple vitamin trace mineral supplement, vitamin C and other nutrients to help keep from getting sick, and other such basic nutrition. Over the years, I realized that a lot of patients, even though I helped them with their aches and pains, they would still suffer tremendous hardship from other serious health conditions: cardiovascular disease, diabetes, autoimmune disease, cancer. And I realized that although I was helping them with their aches and pains, if they were still going to die or suffer from all these serious diseases anyway, how much was I really helping them? So I started addressing these other considerations by helping my patients with healthy diet and lifestyle choices to decrease their risk of diabetes, cancer, cardiovascular disease, autoimmune disease, conditions such as scleroderma, lupus erythematosus, rheumatoid arthritis, Crohn's disease, and find that we were getting dramatic results with these patients. And then I eventually saw that many of my patients were suffering from various hormonal imbalances, not just sex hormone imbalances, but symptoms of adrenal or thyroid hormone imbalance as well. And they weren't getting adequate care from their physicians, primarily because most doctors are so specialized, which is a wonderful thing because it enables them to know a lot about their chosen field of expertise, but they were so specialized they weren't tying together various factors in hormone balance that really need to be addressed as an integrated approach. For example, a woman that has symptoms of sex hormone imbalance typically goes to her medical doctor, her OBGYN, and talks to the doctor about symptoms of sex hormone imbalance, and the doctor pays primary attention to estrogen, pays attention to testosterone only if there's problems with libido, and usually ignores progesterone. Well, they don't realize how the sex hormones relate a lot to adrenal and thyroid hormones. But to get adrenal and thyroid hormone imbalances addressed, you go to usually a family practitioner or an endocrinologist. And they might look at those hormones, but they don't look at the sex hormones. Well, you have to look at it all together, because sex hormones affect adrenal hormones, affect thyroid hormones, they all affect each other. And they all affect the neurotransmitters, the regulatory chemicals in the brain that control mood, emotion, and cognitive function. Now, if you go to your OBGYN and she helps you with your sex hormone balance, but you still have depression or anxiety, then very likely your OBGYN will send you to a psychologist or a psychiatrist. A psychiatrist will generally know that hormones and neurotransmitters can affect your mood and emotions, but they don't try to figure out how those things are affecting your mood or emotions. They just medicate the symptoms with an antidepressant or an anti-anxiety drug. And that oftentimes gets temporary relief, but it oftentimes unbalances other things because they're not addressing the underlying cause. So what I do in my practice is I look at adrenal and thyroid and sex hormone imbalance symptoms and neurotransmitter symptoms. I evaluate which types of imbalances the patient is most likely to be suffering from. Then we order appropriate tests to confirm whether or not a patient actually has those imbalances. I don't guess, I test. And based on the test results, we determine a very focused, targeted approach for patients, and we get outstanding success with these patients. If you're ready for me to help you with your health challenges, you can call me at 702-891-8833. Again, that's 702-891-8833. This is Dr. Mark Baxter from Baxter Health Center in Las Vegas, Nevada. I look forward to serving your needs.